The Trump-era Department of Health and Human Services has chosen to change recommendations around the COVID-19 vaccine. It will no longer be recommended for healthy pregnant women and for healthy children. HHS Secretary Robert F. Kennedy Jr. made that announcement today on social media.
I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule. Last year, the Biden administration urged healthy children to get yet another COVID shot despite the lack of any clinical data to support the repeat booster strategy in children.
That ends today. It's common sense and it's good science.
Well, that statement right there has definitely made a lot of waves. Our medical expert, Dr. Payal Kohli, is here to talk about that change. So break it down for us. Who is recommended to get the COVID shot come this fall, and specifically, who now is not?
Yeah, so before it used to be everyone 6 months and older gets the vaccine. Easy to remember, widespread application. Now, only for over 65 or if you have chronic health problems. So that means no children, no healthy adults, and no pregnant women. Big, big change from before.
But what does that mean if you are a pregnant woman or, do you get it and you have to pay for it, or?
You basically probably can't get it.
At all.
Because there's an issue of access, right? They're going to decrease manufacture of the vaccine, and then there's an issue of cost. I mean, it's $150 per vaccine. Once they take it out of the schedule, ladies, insurance companies stop covering it, right? So even if you wanted to get it, you probably couldn't as a healthy adult. Now, for children, we won't give it to our children. And we know that it spreads very efficiently in children, especially school-aged children who can get very sick with it.
Yeah, that's the whole herd immunity, that we're supposed to protect those that can't protect themselves. And I remember, and maybe I'm wrong, a risk factor for COVID being pregnant.
That's exactly right. So when he says healthy pregnant women, I find it a bit of a paradox or an oxymoron. It doesn't quite make sense because we know that when you're pregnant, your immune system actually changes such that you can be higher risk of complications like pneumonia. We also know that during the COVID pandemic, pregnant women got into the hospital a lot more and had a much higher risk of infection. Now, the argument could be made that we now have an Omicron subset, which is milder, but still I would say pregnant women do suggest some of the highest risk subsets. And if you're saying a healthy pregnant woman, pregnancy in and of itself is an altered state. So what does that exactly mean?
Well, and what are the expectations now from the CDC, the FDA, this new vaccine committee we just saw? What do they want us to do if they don't want us to get this vaccine?
So they basically have such a high bar for new vaccines. So I'll talk you through sort of the two issues. For healthy adults, they say, well, we don't have enough trials. Every time there's a new strain or a new version of the vaccine out, we don't have trials to suggest that it works. Now, we do know from CDC data during the pandemic that it does work in healthy adults to protect them for 4 to 6 months from infection. Not just to protect them, but Sam, like you said, create herd immunity, which means it protects the people around them better. We also know when the vaccines first came out, they did have randomized controlled trials. So to me, it's implausible to keep doing randomized trials every year, every time there's a new version of it. But the second question that they're saying is actually every time they update the vaccine, should we then repeat a randomized trial, even in older people and immunocompromised people, to try to make sure that it works? So I think this dogmatic idea of holding on to randomized trials, we don't do this for the flu shot, right? Every year we update the flu shot. We don't keep studying the same thing over and over again. To me, it's not practical. And what we're doing by getting rid of herd immunity is we're giving the virus more chances to spread. The more it spreads, the more it mutates, right? So we got lucky that we got Omicron. But if it mutates back into something that's really dangerous, and most of us won't be protected because healthy adults won't be getting it, I think we could really be looking at trouble.
So you just stated some of your fears, just in the most simplest terms. And I hate that this is political. It shouldn't be. I mean, you're a doctor. There's scientific data here. Based on the science that you know of, why, in the most simplest terms, is this not a good idea?
So 3 reasons. One, and your immunity wanes over time. It goes down. Whether you've had the infection, whether you've had the vaccine, we know that it goes down. 2, we know that the virus mutates, right? So the more it mutates, the more it changes, the less protection you have against it. 3, we still haven't figured out long COVID, right? And there's still people that are dealing with long COVID. So getting the infection and not dying is not an okay outcome. You could still be living with chronic illness. And 4th is that herd immunity issue. If I don't get a vaccine as a healthy person, I could be compromising somebody who's not as healthy because the infection is more likely to spread to them.
I mean, I'm going to ask you to look in your crystal ball. What happens when you take away the accessibility? What does this flu COVID season look like come fall?
I mean, it looks very scary. It looks like a lot of us getting out of school, out of work, getting into the hospital. And not only that, to me, Alex, the bigger picture, the vaccine hesitancy that's already there is now going to get fed even more, because not only have we created a fear of vaccines, we're now having our public organizations tell us not to get the vaccines. So any uptake of vaccines that was there before is essentially going to disappear.
Dr. Coley, as always, thank you.